Hello students, let us discuss about assays based on agglutination reaction. Agglutination is the formation of visible clumps due to antigen-antibody interactions. The word agglutination is derived from the Latin word agglutinare, which means gluing to. Formation of the visible clumps occurs when the antigen and the antibody are at equivalence concentrations. The antibodies and the antigens that are involved in agglutination reactions are called agglutinin and agglutinogens respectively. Agglutination assays are used to detect presence of antigens or antibodies in a given sample. It is widely used for blood group typing. Principle: agglutination reaction occurs due to antigen-antibody interaction. The antigen involved in agglutination reactions could be surface antigens present on erythrocytes, bacterial particles, or antigens attached to some matrix. These particulates and cells involved in agglutination reactions should have multiple binding sites to form crosslinks, which results in clumping. To form the visible clumping of the antigen and the antibody, the two components should be at equal concentrations. If any one of the two components is at different concentrations, visible clumps are not formed. Antigens are added to antibody containing solution or vice versa at right proportion, and clumping or lattice formation are observed. Agglutination occurs in two stages. First, the sensitization stage, and the second, the lattice formation stage. In the sensitization stage, antibody binds to a single epitope on the antigen particles. In the lattice formation stage, the two antigen binding sites on a single antibody binds to epitopes on two different antigen particles. This causes cross-linking of the antigen particles, and thus lattices are formed. Factors that influence agglutination. Some of the factors that influence agglutination reactions are pH, ionic strength of the solution, and temperature. Agglutination reaction works best around pH 6.5 to 7.5. pH below 5 and above 8 are not favorable for agglutination reactions, as the antibodies tend to precipitate at this pH. Temperature also affects agglutination at the lattice formation stage. For IgG, lattice formation is favorable between temperature 30 to 37 degrees Celsius, whereas for IgM, the favorable temperature is 4 to 27 degrees Celsius. Most of the agglutination reactions are performed in saline. However, some reactions are more favorable at lower ionic strength solutions. Low ionic strength solutions of about 0.03 mol per liter sodium chloride in solution of sodium glycinate are routinely used in blood banks for agglutination assays. Some of the factors that enhance agglutination reactions are viscosity, enzymes, agitation or centrifugations, etc. Increasing viscosity by adding agents like dextran, polyethylene glycol, etc. reduces the water of hydration present around the antibodies and antigen particles and enhances their binding and lattice formation. Addition of enzymes like bromelain, papain, trypsin, etc. reduces the charge present on the particles and also reduces the water of hydration, which enhances lattice formation and agglutination. Physical methods like agitation and centrifugation also increases cell-to-cell contact and enhances agglutination. Classification of agglutination. Agglutination reactions could be classified as follows: direct agglutination, indirect or passive agglutination, reverse passive agglutination, agglutination inhibition, and co-agglutination. Direct agglutination. Direct agglutination is a simple method in which antisera are tested against naturally found antigens. The antigens or particles in these reactions could be a bacterium, a parasite, erythrocytes, etc. It is a simple procedure in which antiseras are added to the antigens to observe the lattice formation of agglutination. This reaction can be done in slides, microtiter plates, or in tubes. It has been widely used for ABO blood group typing, serotyping of bacterial strains using specific antiserum, serodiagnosis of toxoplasmosis, etc. Hemagglutination is a direct agglutination method involving red blood cells or RBCs or erythrocytes. It is one of the most widely used assays for ABO blood group typing. It is a very simple assay without the need of any advanced techniques, and it is sensitive and easy to read. It can be performed easily at room temperature using slides or test tubes. For blood typing, a drop of blood in slide is mixed with antisera against antigen A and antigen B of blood groups. The antigens present on the surface of the RBCs will interact with the specific antisera and clumping or agglutination will be observed. If there is no antigen present in the blood sample, no clumping will be observed and it will be interpreted as having blood group O. Indirect or passive agglutination. Indirect or passive agglutination is the reaction in which the antigens are not naturally present on the surfaces of the particulates but are coated onto particles like latex, silicates, gelatin, erythrocytes, etc. Such antigen-coated particulates are more consistent, uniform, and stable. Antisera are then added to them and agglutination is observed. This method is more sensitive than the direct agglutination method. The carrier particles used in this method is coated with large number of antigens, which increases the binding sites for the antibodies in the test samples and thus increases the sensitivity of the reaction. It is used in testing of rheumatoid arthritis, lupus erythematosus, parasites infection like Trichinella, Treponema, viral infections like cytomegaloviruses, rubella, bacterial infections like Streptococcus, etc. Reverse passive agglutination. In reverse passive agglutination reaction, antibodies are coated onto the particles like latex and not the antigens. Antibodies are coated in such a way that the antigen binding sites are protruded outward and the Fc site binds to the particles. Then the test samples containing the antigens are added and agglutination is observed. It is also a sensitive method to detect antigens present in test samples. It is used in diagnosis of various bacterial and viral infections. Agglutination inhibition. Agglutination inhibition reaction is based on the competition between antigens present on test samples and antigens conjugated particles to bind to the antibody. Antigen conjugated particles are prepared by conjugation of haptens with proteins and coating these conjugates onto a particle. Test samples like urine are first treated to specific antibodies and then mixed with the heptane conjugate particles and observe agglutination. If the test sample contains the antigen, it will bind to the antibodies and no agglutination will be observed. If the test sample does not contain the antigen, then the antibodies will be available to bind to the heptane conjugate particles, which lead to agglutination reaction. Assays based on these reactions are used in detection of illicit drugs like cocaine, heroin, etc., diagnosis of various viral infections, pregnancy testing, etc. Co-agglutination. In co-agglutination reaction, inert bacteria are used as the particles onto which antibodies specific to antigens to be tested are coated. The most widely used bacteria is heat-killed Streptococcus aureus, which has an outer covering of a protein called protein A. Protein A has affinity for Fc region of antibodies and therefore adsorbs antibodies by protruding out the antigen binding sites. When test samples containing antigens are added with such bacterial particles with bound antibodies, agglutination occurs. The inert bacterial particles are more stable than latex and this reaction has high specificity, but it is not very sensitive and cannot be used to detect small quantity antigens. However, it is widely used to identify streptococci and in testing for Neisseria meningitidis, Neisseria gonorrhea, Vibrio cholera, Haemophilus influenza, etc. in patient samples. Applications of agglutination. Some of the applications of agglutination assays are ABO blood group typing, RH blood typing, Widal test for typhoid, Combs test for anti-RH antibodies, detection of illicit drugs like cocaine, heroin, etc., measurement of therapeutic drug levels in blood, measurement of hormone levels in blood, measurement of plasma proteins, stereotyping of bacteria, parasites, etc., diagnosis of infectious agents like bacteria, parasites, viruses, etc., field testing for disease like malaria, diagnosis of STD like syphilis. In conclusion, I would like to say that agglutination is a simple method which depends on antigen-antibody interaction. When antigen and its specific antibodies are present in equal concentration, cross-links are formed which leads to latex formation and agglutination. It is essential that the antigen particles should have more than one binding sites to form the latex. pH, temperature and ionic strength also influence the degree of agglutination. Likewise, other factors like increased viscosity, enzyme treatment, agitation and centrifugation can also enhance agglutination. There are different types of agglutination reactions based on which various types of agglutination assays have been developed. These assays have vast applications in medical diagnostics, identification of bacteria, parasites, blood group typing, etc. Thus, agglutination-based assays are immensely useful technique. Thank you.